Okay. And then, are you planning to have another child or?
And no, not right now.
No, just one child. Okay. And then, how long is the cycle?
32 to 34 days.
Okay. And then before you had a child, how long was the cycle?
They were like 40, 43, 45.
Okay. So, do you have any particular eating habits?
No, I
No.
eat everything.
Eat
Except
everything?
I don't do dairy.
Okay. Okay.
And then before I had my baby, my periods were always really heavy and with a lot of clotting, and my uterus was tilted back. And then after I had her, now it's straight, so that they're not as painful. But I do get nausea, like before, during, and sometimes after.
Okay.
And sometimes low back pain.
Okay. So, you're gonna lie down on your back, please. So you got all that history? Okay. And, sure. She's right-handed, right? Yeah, she's right-handed. The pulse is deficient. There is a right side pulse, the lungs, lung pulse, spleen, kidney, and actually pretty strong, but they're very much string-like, wiry, very wiry, and a little bit choppy with not really flowing freely. And left side, she's got the heart pulse is very, very choppy and floating. Liver pulse is extremely wiry. And kidney also, it's all the pulses are all wiry pulse. And the choppy, wiry. But she's not oscillated. She's right side is stronger, almost 3 times stronger than the left side, which is really not healthy. Should be around the 2 to 1. Okay. So we need to correct this. She's not oscillated or lateralized. So what we have to correct is this pulse pattern, which is all wiry and is moving up and down. It's a typical chomai pulse. It's in my buck, okay, straight up and down, and everywhere I push, the pulse will follow up and down, yeah, like a guitar string going up and down, like this. Okay, that's the typical chomai pulse. And she said that she's getting nauseated. Do you actually throw up?
No.
No. What part of the cycle do you get nauseated?
Right before my period, and it doesn't happen every cycle, but probably like 70% of the time. Just before, during, and after.
Okay, you want to hold on the microphone there?
Before, during, and after my menses.
Okay. Do you have any headaches or palpitations?
No.
Dizziness? Headaches?
Very seldom I'll get dizzy.
Okay.
But no headaches.
Loss of balance?
No.
No. Okay. And then you don't have any tight feeling in the chest?
No.
Hard to breathe?
You know what? Sometimes I'll get a pain in my liver area.
Okay. Okay. Well, that makes sense. Yeah. It's a Shahanos. This is more what we call Shaoyan manifestations. In the extraordinary vessel, this is more to do with the chomai, unregulated chomai. Okay? The chomai problem is the thing is going up, rebelling up. Remember that? Yeah. So the nausea is a real good telltale sign of chomai. And then she had a baby 3 years ago. And then she started having this long period, Long period also has a lot to do with the, what's wrong with the long period? Yeah, liver and spleen are not harmonious with each other. Okay? And a pulse is showing that. May I check your stomach, please? Do that.
Yeah, and then there's always that pause for 2 days where there's no bleeding at all.
Yeah, that's around the ovulation.
Huh? No, I'll have my period for 3 days and then it stops completely, no blood for 2 days, and then 4 days spotting and gushing alternating.
That's definitely Chong Mai. Yeah, Chong Mai is deficient. The thing is, she hasn't recovered from the last birth yet. You went back to work? You went back to work right away, or?
School, yeah.
Oh, school. It's not the notorious acupuncture school, is it?
It was.
Well, she doesn't really have a lot of subcostal tension. The heart area is also pretty good. And kidney channel, she's much more spleen deficient by abdomen, and then by far the weakest is the kidney deficient. Only thing I can see as the liver is she's got all this purpleness. Let me get a pen here. We need a light pen. Did I bring my light pen? Yeah, that's it. I don't want to shine. Okay, let me look at the tongue here. You turn that way. Yeah, tongue is very, very damp with pretty thick white coating. Can you curl up your tongue, please? Her veins go way up to the tip of the tongue. The liver is very, very congested here. See? Yeah. Okay. So, Chong Mai is called a sea of blood, okay? And her blood is not well regulated. Her liver seems to be congested way up to her tongue. When we look at it in Japanese tongue diagnosis, we look at the back of the tongue, underneath the tongue, okay? And then they look at how high, how far up the vein goes up. Hers is almost going up the tip of the tongue. That's a pretty serious liver blood stagnation, okay? Liver blood stagnation. And that's because the Chong Mai is not working properly. And she also got a lot of a thick white coat. Okay, that is again a damp coldness in the spleen. Okay, so those two are mixed together. Liver itself is really congested with the blood, and that's why she had this very strange period. And we need to regulate the Chong Mai. Okay, so. What point would you like to use for Chong Mai?
Stomach 30.
Stomach 30, okay. That's very good. Yeah, the stomach 30 will. Is that tender there? More tender here?
Yeah, that's tender.
Over there. A little tenderer. Just tender. Yeah, these 2 points are very good points to treat. for Chiang Mai. And then for the liver, spleen, okay, liver, spleen, channel divergences, the master point for the liver is gallbladder 1. Okay, I use gallbladder 2 because I'm a wimp. I don't like to need a gallbladder 1. I use gallbladder 2, and then gallbladder 34. Okay, this is a whole point. Okay, and then like Robbie said, I will use over here. She's a right-handed person, so we go yang goes to the right side, gallbladder 34, and then gallbladder 2 on the left, and then liver 8, the tender there.
Yeah.
Yeah.
Very
Liver 8 on the left. Okay, and then again, positive over here, upper gallbladder 2, and then negative on gallbladder 34, and then liver 8. Okay, so that's a proposed treatment. Let's try this first.